Hello, hello, hello. It's Constance here, presenting for Parenting Genie tonight. And tonight I am revisiting a topic that is very relevant for this time of year, and it's mastitis. And I put in the headline that it's a holiday connection. So we are in the festive season, in the holiday season, and many mothers would have had the babies and may already have had some mastitis, and you would know what it feels like. But you may have never had mastitis and you've been feeding your baby beautifully, and so all of a sudden it's going to hit you. And there's reasons why there's a holiday connection, and I will go through it tonight. So first of all, what I'm saying tonight is from my point of view, from my educational point as a lactation consultant. However, I do not know where you're at with your breastfeeding journey, so it's not replacing medical advice. So that's very important. If you have mastitis and you're feeling sick and you're thinking that I have all the answers tonight, then I have to disappoint you. You need to see your medical practitioner or your healthcare provider. So, I would like to just give you an idea what mastitis is. So I've got a bit of a cheat sheet here as well, just to keep on track. So if I do not look into the camera, that's why. So mastitis is an inflammation, or it can also be an infection. So when it's in inflammation, then it's usually localized to one part of your breast. There might be a lump, there might be redness, it might be painful. It could be just a blocked duct, but it could also be mastitis already. So inflammation. Now, when you get what is called systemic signs, such as a fever, feeling really, really tired, quite painful, you almost feel like you're coming down with the flu, that is more than just a localized inflammation. That is your whole body giving you signals that something is not quite right. And that means you have an infection. There is bacteria in that milk duct or where the localized inflammation is. So in the breast, a hard, painful lump, skin feels hot to touch, persistent redness, often a wedge. It's non-infective mastitis. But then if your body is showing aches, chills, a temperature 38.4 and above, and extreme fatigue, excuse me, then that would be your infective mastitis, and you certainly need to get some medical aid there as well. So why is it important to revisit mastitis? Because the protocol has changed a few years ago. We have a body called the Academy of Breastfeeding Medicine, and they are located in America. However, there is Australians and English and other medical professionals who have reissued a protocol. It's called number 36, the mastitis protocol of the Academy of Breastfeeding Medicine. And so I will go through a few things that have changed tonight. So first of all, we're using the abbreviation of BAIT, B-A-I-T protocol. And B stands for breast rest. So do not overfeed, do not overpump, because it does actually increase inflammation, which can cause other issues like an oversupply that can cause more mastitis and more inflammation. So we are going to continue as usual, if possible, in terms of our feeding management. The A stands for anti-inflammatories. So here in Australia, we have ibuprofen, and that can be taken safely whilst you're feeding your baby. And it is a way to reduce swelling. And then the I is really, really important. So the I stands for frozen peas, a very helpful thing in your kitchen or in your freezer. Or you can just use one of those ones, but it's probably a little bit big for your breast. And if you use it, make sure that you've got a flannel or a towel around it. So ice. So what has changed dramatically in the protocol of treating mastitis is that we do not use heat anymore, unless there might be something that feels good, to get that milk flowing. You might put a heat pack on just briefly, but it's the ice to help to reduce inflammation. And it makes sense, because if we have a sprained ankle and we have inflammation in there, we don't put heat on it, we put cold on it. So yeah, ice. And this is the biggest change. Heat increases the blood flow and the swelling. So we use cold packs for 10 to 15 minutes after feeding to soothe the area. And then the T is interesting because it has got different ideas from different protocols. So T actually stands for therapeutic positioning. And what does that mean? It means that if you have mastitis in this part of the breast, you might find that it's really hard to feed your baby because your baby might even poke, and it's painful. So what you can do is you can put your baby in a football or underarm position and feed your baby that way. Then you won't have nothing touching that area that is sore and swollen. So just as an idea, okay. Avoid vigorous massage. That's another thing that has changed a lot, because women with mastitis used to be told to do massaging, to massage that lump out, and then massaged and massaged and massaged to the point that they increased inflammation to even having bruises, and it also increased the swelling to the point that the milk is not able to flow through the ducts because the walls of the milk ducts are swollen. So we also do not recommend electric toothbrushes or vibrators that you can buy to put on your breast to try to get things flowing. It's not recommended. Again, it's always remember that sprained ankle. You would not put an electric toothbrush or a vibrator on your sprained ankle to help reduce swelling. So the holidays can make people wait it out. So the holidays like Christmas, obviously, and that's not a good idea. Do not wait it out. So if you feel sick, you need to see a doctor. Consult a professional. If the symptoms do not improve after 12 to 24 hours of home care or your home remedies that we've just discussed. So 12 to 24 hours. So if you've done that management and it's not improving and you're feeling really, really worse, then go and see a doctor. You may have to go to an emergency department to be seen if there's no doctor available. Also see a doctor if your fever is rising. And also if you see sort of, red streaks moving away from the area. So if you've got mastitis in that area, and then all of a sudden it actually goes further into the breast and it's sort of streaky, that's another reason, because the home care is not working. So you can feel so deathly ill, that can be a sign of sepsis. And so you've got to have a backup plan also if you've had planned to have big Christmas parties and New Year's parties. So why am I saying that there's the holiday connection? So why is mastitis seen quite frequently in the holiday season? And I have been going out on home visits on public holidays to just help mothers out. And the reason for it is that we are stressed. We're trying to prepare this big celebration of Christmas, cooking and baking and shopping and presents and all these sort of things. So we don't take care of ourselves very much, and we might shorten the feed. We take the baby off before the baby's actually given us cues that the baby's finished with that one side. And we may also not realize that maybe we have a little bit of a sore nipple because the baby may not have been attached so well. And today I'm not even going into early reasons for mastitis like poor attachment, but I do bring it up briefly that is important, because if you are just in the process of learning to breastfeed well and you think, I'm just going to put the baby on, I'm not even checking whether the baby is latched really well and deeply, then that could lead to some trauma of the nipple, and that could also then exacerbate some mastitis issues. So now, if you are going to talk to your doctor or you're seeing your doctor, then it's most likely that your doctor will put you on some antibiotics. Now, this is not a reason to stop breastfeeding or to wean. The antibiotics will go through your breast milk in very minute amounts, but they are completely safe for your baby to go through their system. They may have a little bit of runny poos, and that's okay. Breastfeeding, continuation of breastfeeding during mastitis is part of the treatment. If you decide to wean, that could give you more trouble because it could lead to an abscess. So the mastitis needs to be cured first before you can consider stopping breastfeeding or weaning, if that's what you want to do because you were too ill to continue or you were too anxious to continue. The rates of mastitis are frequent. So in the first few months, usually 1 in 5 women will get some mastitis. There's also other things that you can do. So if it's too painful to latch your baby to the breast and let the baby feed, you can pump or express with a breast pump. But again, do not overdo it. Don't try to get all this milk out, because you are causing more damage and more trouble there. Now, I want to go back to where I started, why the holiday connection. It's not just the stress of shortening feeds and putting the baby into somebody else's arms so you can prepare celebrations. It might be the parties where you wear some tight bra or a tight dress. So that could restrict the milk flow. The other thing that I'm concerned about is also our very new pumps, the wearable breast pumps, because I've seen some mothers wearing them non-stop and they leave indentations in the breast, those pumps that you put in your bra and you don't have to do anything. You just turn it on and, it'll pump. So again, be careful with that. Really important. And then also the food that we eat around Christmas time could sometimes have a little bit of an effect of inflammation as well, because it might be high sugar, high fat. You may even have the occasional alcoholic drink, and that's okay, but you got to be looking after yourself. Now, the other thing that is really important when you do experience mastitis is to hydrate. So here we go. Quite a few of those bottles a day. Water. Best. Right, now, where are we next? So some antibiotics are not compatible with breastfeeding, or not with actually breastfeeding, but with you if you are allergic to penicillin. So you have to tell your doctor if you are allergic to penicillin, because then they prescribe you another antibiotic for mastitis. Some babies may go on a nursing strike during the time that you experience a mastitis. The reason for that is that even without the antibiotics, the milk taste changes. There's more sodium or salt and chloride in the breast milk. And so especially older babies might come off and sort of think, what the am I tasting here? In those situations, it's good to consider a sleep feed where the baby is not fully awake, but you see the baby giving you cues that they want to feed because they're sort of half asleep, but they're rooting for a feed, and then they're not so aware of the taste. It'll change. Yeah. Also, for some mothers, what they experience is a little temporary dip in their milk supply when there is mastitis. It's common to see a drop in the supply on the affected side, again, due to the inflammation. And in fact, it's a protective mechanism to reduce the supply temporarily because of the pressure on those milk-making cells in your breast. I won't go into too much of the physiology, and not to me tonight. Another option is probiotics, especially when you are on antibiotics, even afterwards. They are kind of inconclusive still. They have been trialed in different research trials because certain probiotics are linked to good outcomes for mastitis, even in the presence of not taking antibiotics, but more research is needed. But it certainly does help a good microbiome or good gut flora, good bacteria to take some probiotics, maybe not at the same time as the antibiotics because they can interfere with each other's uptake. The other thing that you could take, and it's absolutely harmless, is lecithin. So lecithin is it's sold in granules, often in supermarket health food sections, but also in the health food shop. And it can also come in capsules. Now, lecithin granules, they kind of make the milk more liquidy. They dissolve the molecules, the milk molecules, a little bit more in the milk. So, and that can help to get the milk flowing a little bit better. Again, there's not too much research behind it, but it's certainly not harmful. And some mothers have certainly had good effect from that. Okay. So that almost leads me to the end of my talk. So just to recap it briefly. So we can have inflammation or infection. Inflammation is locally, and it might look, I have got a little breast here that is a demo breast, and it has the effect of, so you might actually find that it's quite red, on one side or the other side. And so, so that is definitely mastitis. So, and okay, so in terms of my recap, treat it early, do look after yourself, do a breastfeeding honeymoon, rest, and have lots of good fluids in terms of water. Do take regular anti-inflammatories, non-steroidal ones, like your ibuprofen, and you can also take Panadol for the pain relief. Your doctor or your pharmacist will recommend in, which dosage you should be taking it. Keep feeding, do not wean, do not stop nursing, because stopping abruptly can lead to an abscess in your breast. The milk that your baby takes may make your baby a little bit fussy temporarily because of the salt in the milk, but that's only temporarily. Your milk supply may dip a little bit. Again, it's okay. it'll pick up afterwards again. Keep offering the breast that is affected if there's a drop in the milk supply, and it will definitely come back. The medication that may need to be prescribed, the antibiotics, are set for your baby. So there's no reason to suffer through the holidays in pain. Do consider getting a lactation consultant involved in the care of your breastfeeding issues. And if that's not possible, then certainly a GP who is specialized in women's health, because that could help you with sorry, my husband just came out, so I lost my track. So sorry, I just told him to go away. Okay, so so the final tip is to stay hydrated and keep festive bras loose, so those brassieres, and prioritize your rest, and just tell yourself that you are doing a fantastic job feeding your baby. And always remember, the frozen peas or the frozen ice pack could be absolutely your, unfortunately this has been opened, so I have an unopened one, and you can put that nicely in some cloth and put it on your breast for 10 to 15 minutes. So yeah, on that note, I think I could say happy holidays and stay healthy and have a wonderful time. If it's your baby's first Christmas, it's very special. You may even have a special bauble, baby's first Christmas, on the tree. If you do not celebrate Christmas, still be careful that you do not overdo any festivities without actually being very very tuned into your baby's cues with feeding. And yeah, so if you need more information, you can also go through the parentinggenie.com.au website. We do have lots of fantastic protocols. Go through the parentinggenie.com.au website. We do have lots of fantastic protocols there and information. And you can still sign up for a 2-week membership, free membership, just to see what Parenting Genie is all up to. And on that note, I'll see you next year in about 5 weeks. You can just log in. I think maybe it's the 21st of January when I will be doing another video, and it's more likely to be a baby wearing topic again. And on that note, baby wearing, that's another thing to make sure. Yes, your baby needs to be close to you, but you don't want to have anything that is too tight on you, where it is digging and restricting the flow of your milk. Okay. Merry Christmas, Happy New Year, see you next year, and I look forward to it. Bye for now.